Good morning, good afternoon, good evening. This is Dr. Kelly here again. I'm going to give you a quick synapse on why chiropractors treat the spine. So I want to give you a quick anatomy lesson here first. This would be two segments in your cervical spine. So let's take these two for example. Now, the only reason chiropractors treat spine is to help the brain and the spinal cord, which is called your central nervous system, communicate with every system, organ, function of your entire body. Now, how we do that is we don't click bones into place, we don't pop joints, we don't crack backs, we don't align you, we don't push something in that fell out of place. What we do using gentle techniques is we restore movement and function to the spine because of one very important thing. We have a spine mainly for a reason why we have a skull. We have a skull for protection. Now, the skull protects the brain. So if I took my finger and I touched my brain, would that be good news or bad news? That'd be pretty bad news. Now, the brain turns into your spinal cord, which sits right here into your cervical spine, or in that matter, all the way down through your spine. The bones, which are also meant for protection, have to allow us to move. So in order to move, we have to have joints which allow the structures to bend and twist and turn the way they're designed to. So we had to sacrifice some stability for movement. Now, in this area around where the joints are, right where in between, a nerve exits out in between two segments of your spine, which is supported by a disc, which is a shock absorber and a spacer, because the thickness of it creates a gap where the nerve exits out of. Now, as chiropractors, we try to restore movement and function so that we can alleviate any tension or pressure off of your nervous system. So if you start getting tingling in your fingers, is tingling the problem or is tingling the symptom? Correct. If you said symptom, you're correct. Now, if you had pressure on a nerve or nerve interference, that nerve that comes down the brain, out the neck, down to the fingers, and back up again transmits an electrical impulse. If there's a squeezing pressure or interference or distortion to the segment because of a rotation, a bend, a curve, a damage, degeneration, then there would be pressure on this nerve which would cause the tingling. So you can't take a pill to treat tingling because that doesn't treat the cause. You can't massage the hand to get rid of the tingling because it's not treating the cause. So as chiropractors, we treat the cause, which is the tension on the nervous system. So I just wanted to get that out there for you because a lot of people say, going to the chiropractor, I get my back cracked, I get a click, a pop. You know, these are things that are a nitrogen gas release in through the joints, but they are not getting people better. That's just a byproduct of the adjustment. So if you're looking to if you're looking to see what we do as chiropractors, that is what we do. All right, thank you very much.